Let's look at the humerus, and we're going to look at both the proximal and the distal humerus, although for the pectoral girdle, we're focused mainly on the proximal humerus. So we have a posterior view and an anterior view. You see medial and lateral on either side. The proximal portion of the humerus articulates with the glenoid fossa of the scapula, forming the glenohumeral joint of what we call the shoulder complex or the pectoral girdle. The glenohumeral joint moves through all three planes of motion: flexion, extension, medial lateral rotation, ABA deduction, and then there's actually a fourth motion called which is the horizontal AB and adduction. So we have a lot of mobility and range of motion in our glenohumeral joint. So let's look first at the humeral head, not quite as big as a femoral head. It articulates with the glenoid fossa of the scapula. And so it's pointing medially. We have the anatomical neck, which is right under the head. And then we have the surgical neck, which is a little bit lower down. And that would be where there's any sort of, if you had to replace your shoulder joint or your GH joint for any reason, they would probably take off the entire proximal part of the humerus. Then on the lateral side, we can palpate the greater tubercle underneath your deltoid. And it's the greater tubercle because it's a site of many muscle attachments. And so a lot of, if bone has a lot of loading on it from a lot of muscle attachments, it will become larger. And therefore we have the greater tubercle. And then we also have the lesser tubercle. And you can feel the lesser tubercle on the anterior view. And then in between the greater and the lesser tubercle, we have the intertubercle, so between the tubercles, or sometimes called the bicipital groove. And that's where the biceps brachii long head tendon travels. We also, on the lateral side, about midway down, we have the deltoid tuberosity. If somebody has very well-defined deltoids, they kind of disappear into that insertion point, which is not quite midway down on the humerus. If you're a Warriors fan and an older Warriors fan, Andre Iguodala has a great view of the deltoid tuberosity, or the insertion point of the deltoid muscle. So the distal portion of the humerus articulates with the radius on the lateral side or the thumb side and the ulna on the medial or pinky side. And the articulation between the humerus and both the radius and ulna form the elbow joint, a hinge joint, which results in flexion extension in the sagittal plane. So we have the trochlea, which articulates with the ulna, and that is shown as number 8. And then the capitulum, which is kind of a round ball, and that articulates with the radius, and that's number 9. Number 10 is the coronoid fossa. So it's a fossa above the trochlea on the anterior side, as opposed to the conoid tubercle, which we saw on the clavicle. So this is the coronoid. We have the radial fossa, which is above the capitulum on the anterior side. And then on the posterior side, we have the deep indentation, which is the olecranon fossa. Then we have the medial epicondyle on the medial side, the lateral epicondyle on the lateral side, and then above those epicondyles, we have the supra, or superior to the condyles, so the supracondylar ridges.